Stage 1. No impairment. This is the invisible beginning. At this stage, a person shows no symptoms whatsoever, and no test would reveal any cognitive problems. Memory works normally, daily tasks are handled without difficulty, and there is nothing outwardly wrong. But in some people, the disease process has already begun at a biological level. Amyloid plaques, the abnormal protein clumps associated with Alzheimer's, may already be forming in the brain years or even decades before the first symptom appears. This is one of the most unsettling aspects of the disease. It can be silently building for 15 or 20 years while a person feels perfectly fine. Research into blood tests and brain imaging is making it increasingly possible to detect these early biological changes, but at this point, there is still no treatment that can stop the process once it is started. Stage 1 is a reminder that Alzheimer's is not just a disease of old age. It is a disease that begins long before anyone knows it is there. Stage 2. Very mild decline. This is where the earliest hints of change may begin to appear, though they are subtle enough that they are almost always attributed to normal aging. A person might occasionally forget a familiar word during conversation, misplace their glasses more often than usual, or have a brief moment of confusion about what day it is. These lapses are minor and inconsistent. They do not interfere with work, social activities, or independent living. Friends and family members rarely notice anything different, and a standard medical exam would not detect any cognitive impairment. The distinction between stage 2 Alzheimer's and ordinary age-related forgetfulness is nearly impossible to make in real time. It is usually only in hindsight, after the disease has progressed further, that these small changes are recognized as the very first signs. This stage can last for years, and many people never progress beyond it.
Stage 3. Mild decline. This is the stage where other people begin to notice that something is not quite right. The person themselves may also become aware that their thinking feels different. Memory lapses become more frequent and more noticeable. They might struggle to find the right word in conversation, forget the name of someone they just met, or have difficulty retaining information they recently read. Organizing and planning may become harder, and misplacing valuable objects starts happening more often. At this stage, a careful medical evaluation can usually detect measurable cognitive changes. However, the person is still largely independent and can handle most daily tasks on their own. Denial is common at this point, both from the individual and from family members, because the changes are still mild enough to explain away. Stage 3 is sometimes called mild cognitive impairment, and it is the point at which a formal diagnosis becomes possible for the first time. Stage 4. Moderate decline. This is the stage where the diagnosis of Alzheimer's disease becomes clear. The cognitive problems are now significant enough that they are obvious during a medical interview. A person may forget major events from their own recent past, struggle with basic arithmetic, like counting backward from 100 by sevens, or have difficulty managing finances and paying bills. Planning a dinner party or navigating an unfamiliar route becomes challenging. Personality changes may also begin to emerge. Withdrawal from social situations, increased moodiness, or emotional flatness. Despite these difficulties, the person typically still recognizes family and close friends, can remember their own name and address, and can handle basic self-care like dressing and bathing. This stage usually lasts about 2 years and represents a turning point where the need for support and supervision starts to become apparent. Stage 5. Moderately severe decline. At this point, gaps in memory and thinking are large enough that the person needs help with day-to-day activities. They may be unable to recall their own phone number or address, become confused about where they are or what season it is, or struggle to choose appropriate clothing for the weather. Simple decisions become overwhelming. However, they still generally remember their own name, the names of their spouse and children, and do not yet need help with eating or using the bathroom. This stage is often when families begin to seek outside assistance, whether through home care aides or adult day programs. The emotional toll on caregivers intensifies
because the person they know is still present in many ways, but is clearly slipping further from reach. Stage 5 can last anywhere from 1.5 to several years and marks the transition into a level of dependence that fundamentally changes the family dynamic. Stage 6, severe decline. This stage brings profound changes. Memory continues to deteriorate to the point where a person may forget the name of their spouse, have little awareness of recent events, and retain only fragments of their earlier life. They increasingly need help with basic activities, bathing, dressing, and using the toilet. Incontinence may develop. Personality and behavioral changes become more pronounced. Wandering, agitation, suspicion of caregivers, and repetitive behaviors are common. Some people develop delusions, believing things that are not true, or fail to recognize familiar faces. Sleep patterns often become disrupted, with restlessness at night and drowsiness during the day. Despite the severity of the cognitive loss, moments of emotional connection can still occur. A familiar song, a gentle touch, or a calm tone of voice can sometimes reach through the fog. This stage typically lasts about 2.5 years and is one of the most physically and emotionally demanding periods for caregivers. Stage 7, very severe decline. This is the final stage of Alzheimer's disease. The person loses the ability to respond to their environment, carry on a conversation, or control movement. Speech may be reduced to a few words or lost entirely. The ability to walk, sit upright, and eventually swallow all gradually disappear. Full-time care is required for every aspect of daily life. Muscles grow rigid, reflexes become abnormal, and the body becomes increasingly vulnerable to infections, particularly pneumonia, which is the most common cause of death in Alzheimer's patients. Despite the near-total loss of outward function, there is evidence that some level of awareness may persist. Familiar voices, music, and physical comfort can still produce visible responses in some individuals. This stage can last from 1 to 3 years. It is a period of grief for families who must watch someone they love fade away while still being physically present. The focus of care shifts entirely to comfort, dignity, and quality of life in whatever form that can take. If you found this video helpful, make sure to hit that subscribe button and turn on notifications so you never miss a new upload.